not an everyday topic most teens are willing and wanting to talk about, but it's something that should be talked about because it's important. And it's not only, contraceptives aren't only used as a pregnancy prevention, but as a birth control method for other reasons that are caused by your menstrual cycle. And guys, condoms aren't only used just to prevent pregnancy either. And as I go and talk about contraceptives, it's very important in the teenage and reproductive stages because according to the non-contraceptive benefits of birth control, there are 11 other reasons that they list that helps, like birth control can help with, other than just pregnancy prevention. The first one is dysmenorrhea, which is intense urinary contractions because of the lining in the uterus and stuff, so it's like severe pain, and it affects 90% of young women in the reproductive age. The second is PMS and PMDD, which is a very physical or emotional symptoms that are caused 5 to 11 days prior to your menstrual cycle. And this PMS causes or affects roughly 75% of women, and PMDD is just a more severe case of that, and it affects roughly 3 to 5% of women. Acne is obviously breakouts to your face and shoulders is the most common areas, and that affects, and then there's the hysterism, which is you have too much of the male side effects, and so it causes like hair growth on your chin, and there's contraceptives that can help with that. And then there's the menstrual migraines, which are caused when you have your menstrual cycle, and it just triggers a really bad migraine, which affects roughly 8 to 14% of women in their reproductive years. And there's irregular menstrual cycles, which is when your cycle is, you don't know when you're going to get it, so then it causes you to freak out and stress out more than it is necessary, and the pill can help you regulate that. And then there's endometriosis, which is pain, irregular bleeding, and possible infertility because of the lining of your uterus. The buildup is building up elsewhere, and it just causes severe pain in that. And then there's menorrhea, which is excessive menstrual bleeding, and this happens to roughly 10% of women. And the 8th reason is endometrial cancer, which starts in the lining of your uterus and is the most common type of cancer affecting it's 90% roughly of the uterine cancers out there. And then there's ovarian cancer, which starts in your ovaries, and it's the 5th most common among women, and the most female deaths occur from this kind of cancer, and it's roughly affects 30,000 individuals a year, and half of those die, so your chances of surviving that are 50%. The 10th is colorectal cancer, which starts in your colon and is one of the leading deaths caused by cancer related in the U.S., and it's the 4th most common, so it's right in front of colon cancer. And this can affect both men and women, so the pill is there to help women with this, and it's very effective in helping to reduce your risk of catching it. And then the last other method for a contraceptive is bone mineral density, and this is a measure of your bone density. And a combination of birth control pills can help you to increase your bone density. And according to the Women's Health Weekly, birth control is just not a pregnancy prevention. And condoms aren't just a pregnancy prevention either. They are there to stop STDs and AIDS from being spread. So it's very important that if you are sexually active, you talk to your doctor and get birth control methods to help you prevent pregnancy. And guys, use condoms so that you don't spread STDs or catch one. And according to the New Yorker, 99% of all American women who have been sexually active have in one way or another used a contraceptive at one point in their life. And teens, according to Teen Health and Wellness, teens, there's reasons they have sex, but they're not good reasons, and don't just do it to maintain or make your relationship better with your partner, because that's not a good reason for it. And don't just do it because your friends are doing it and it seems cool or makes you seem cool if you say, hey, yeah, I had sex. Like, it's not worth it, and just don't do it out of curiosity. And don't just say it just happened, because it doesn't just happen. You are the one who gave into the peer pressure, and that's not a good thing. And don't be scared to talk to your doctor. Just go, well, first off, talk to your parents about it, because it's not something that should be avoided. I talked to my doctor, Jim McGuire, about it, and he said that the pill benefits more than just a pregnancy prevention, and it's there to help regulate your menstrual cycle or lighten up a heavy flow, and it helps with cramps. So just go talk to your doctor. Don't just think as a contraceptive as a pregnancy prevention. Yeah, it's there to help that, but it's there for many more reasons like I listed previously. So go out and talk to your parents or your doctor about it, because it's not worth catching an STD or an AIDS and getting pregnant.